Hi, my name is Liz Party, and I will present antibiotic-resistant syphilis. Syphilis is a sexually transmitted disease caused by the bacterium Treponema pallidum. The WHO estimates that worldwide 5.6 million cases are diagnosed each year, and the incubation period can last 10 to 90 days, averaging 21 before initial symptoms appear. Those at greatest risk are those who engage in unprotected vaginal and anal or oral sex, have multiple sexual partners, are men who have sex with other men, and individuals who are HIV positive. Syphilis occurs in a couple different stages. In the primary stage, cankers that are painless appear and can last up to 6 weeks. If treatment is not received, symptoms go away and syphilis progresses to the second stage. The second stage is characterized by mucous membrane lesions or a rash. The rash may go unnoticed and can appear anywhere on the body. Flu-like symptoms may appear, like fever, swollen lymph nodes, fatigue, and headache. As with the primary stage, if untreated, it will progress. After the second stage, there is a latent period where there are no symptoms present. The tertiary stage can occur several years after the primary infection and can be fatal, causing multi-system organ failure. This slide creates a visual representation of the stages of syphilis. Additionally, congenital syphilis is a concern. This occurs when a pregnant woman passes syphilis to her unborn child, causing an increased risk of miscarriage, stillbirth, or death, as well as neurological symptoms, including meningitis or skeletal deformities. 50 to 80% of maternal syphilis cases are associated with adverse birth outcomes if left untreated. And this slide creates a visual representation of congenital syphilis. Testing should be done based on completion of a health history. If indicated, a blood test or spinal tap can be completed to test for the presence of antibodies. Antibodies are an indication of a current or previous syphilis infection. A spinal tap should be reserved for a patient who is experiencing nervous system complications. The CDC also does recommend that men who have sex with other men be tested every 3 to 6 months because they are 106 more times likely to contract syphilis. The first line of treatment for syphilis was discovered in 1943, and that is benzathine penicillin. These injections are given in 1 to 3 doses depending on the stage of syphilis. It should be noted that there is a worldwide shortage of benzathine penicillin, leading to a decrease in treatment. So how is it becoming resistant? There is a misuse of antibiotics. There's an overuse of antibiotics, and this creates the evolution of bacterium to become multi-drug resistant and unresponsive to penicillin. The WHO does recommend that guidelines are enforced for treatment, which include the right antibiotic, the right dosage, and the right time. Medical professionals have a responsibility to protect themselves by being educated and using proper PPE during blood or spinal tap testing. It is also imperative that thorough health histories are taken and education given to those with an increased risk. Medical professionals also need to be up to date on proper treatment indications and follow recommendations as suggested by the WHO. I wanted to add information related to the Tuskegee syphilis study that spanned over 40 years and drew attention to the severe violations of ethical standards by using Black men as human guinea pigs for studying syphilis without their knowledge or consent. And these are my references. Thank you.